You are watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Ahmadi, MD. Dr. Ahmadi is board certified in both general surgery and by the American Board of Plastic Surgery. I've been told by other plastic surgeons that Dr. Ahmadi is one of the best plastic surgeons in the world. He's here today to discuss the procedure that he developed, the Lipotuck procedure. Dr. Ahmadi, welcome to the program.
Thank you, Randy.
The Lipotuck. You pioneered this procedure.
Yes,
Is that correct?
I did. Yes.
It's a combination. Liposuction, tummy tuck.
Liposuction and tummy tuck. It really works well. It took me a long time to work on it and get it right. It is really a unique combination of tummy tuck and aggressive liposuction.
Now you trademarked this.
I did trademark
Is that right?
it because it really is not just a liposuction or tummy tuck. It really is a combination of the two, so hence the Lipotuck.
Are you teaching other doctors this technique yet?
Not yet, but soon. I think once the buzz gets around, we will have to start doing some of that too.
Now we've talked off camera, and why this focus on Lipotuck? Why do you like it?
Well, Randy, when I started doing tummy tuck, I was very unhappy with what it did, and basically what it didn't do for the waistline and the upper abdomen. If you take a typical patient, they usually have excess skin, but that excess skin usually wraps around the body. Where the tummy tuck stops, it usually works for the lower abdomen, but stops for the upper, doing anything for the upper abdomen or the waistline. So liposuction takes over from then on.
Now we've invited you on the show to talk about the Lipotuck, but your practice, I mean, you do everything there?
Pretty much everything. Take it from the top, do Botox, the fillers, the Restylane. We do brow lifts, eye lifts, rhinoplasty, implants, mid-facelift, otoplasty, which is pinning back of the ears. Certainly we do breast work and body contouring, which usually involves tummy tuck and liposuction and lifts.
Okay, now moving on to Lipotuck. Tell us, so this Lipotuck, define it. What does it mean?
In a few words, it's a very unique combination of a tummy tuck and a very aggressive liposuction of the areas that traditionally were not done before.
What do you mean they were not done before?
Well, during my training, we are usually taught not to do too much liposuction of the abdomen and the waistline during these procedures because they're assumed not to be safe, and we were always taught that it may complicate the outcome. However, I'll show you in a few minutes that that's not the case necessarily.
I talk to surgeons and they say liposuction should only be used for those last little 10-pound, little pocket areas that you can't get with diet and exercise. You're saying that you'll work on the person that's 60, 80, 100 pounds overweight. I mean, is that right? I mean, you haven't said that, but is that correct?
I think we need to look at this thing a little bit differently. When people come to my office, when these ladies come to my office, they've gone through the gym, they've done all the diet, they've done all the exercising, they've signed up at the gyms, they have their own personal trainer. It hasn't done them any good because they're not motivated.
Okay.
The motivation being they want to look nice.
Sure.
It has not worked at all for these ladies. They're at the end of the road basically. So here I come and say, let me work on one section and one section only. I'm not talking about a whole body liposuction, weight reduction, body lift or anything like that. Take one section.
Which is their abdomen?
Which is the abdomen, the back and the flanks and hips and all that.
Okay.
And making it perfect. Just making it come out perfect. And then tell them, I've given you what you wanted. Now it's your turn to give me what I want from you. And that is, I want you to get in the gym.
Good.
Exercise. I want you to change your dietary habits. I don't want you to go through the drive-thrus anymore. You're going to eat healthy fruits and vegetables and salads. Get rid of all your diet pills.
Good.
And I want you in the gym. And my girls are going to call you. We're going to call you and bug you to make sure that you're following through with the program.
So you're not afraid to do surgery on the patient that's 60, 70, 80 pounds overweight?
I would use that with caution. I choose my patients carefully. They have to be motivated.
Motivated 60-pound, 70-pound overweight person?
Not a problem.
Really?
Not a problem.
Okay, good.
They have to be motivated and they have to be healthy. Obviously, this is an elective procedure and the outcome needs to be safe. Okay. We're not saving lives and we're not doing hard bypass surgery on a sick patient. We're taking a healthy patient and we want the patient to come out healthy at the end of the day. Okay. So this procedure is for overweight people, but we're looking at it differently. Let's give you a jump start. Let's get you in the gym and do the rest by yourself now.
Good. Okay, we're going to take a quick break. When we're back, we have to look at these photos. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We are talking about the Lipotuck procedure with board-certified plastic surgeon Dr. Ahmadi. We'll be right back.
Oh my God, Lipotuck has changed my life in such a tremendous way. My self-esteem, my appearance, all of the compliments that I get from other people. Since I've had Lipotuck, I feel much healthier. Actually, I feel like I almost had a gastric bypass. I don't eat as much. It's just totally made a change in my health status. After having the procedure, Lipotuck made me feel like a new woman.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We are here with board-certified plastic surgeon Dr. Ahmadi, and we're talking about the Lipotuck procedure. Okay, Dr. Ahmadi, a recap, people just tuning in. We're talking about high-volume liposuction, tummy tuck. So let's move to this first photo.
Let's take a look at this before picture. She is one of my most favorite patients.
Okay.
She has a lot of history. She came to my office, and there was something about her that I sensed, something deep. As if she had been very depressed for quite a long time, and I knew that her concern was her tummy.
Okay.
But she'd been turned down. She had been offered more aggressive procedures like the gastric bypass.
You mean she was turned down by other surgeons
by the
to do lipo or tummy tuck?
No, for the tummy tuck, but they couldn't guarantee that she would come out flat and chiseled, that hourglass form that she was looking for.
Okay.
She saw through other friends, people that I have done, and she got to know me, and she came to my office finally. Very shy lady, very shy at the beginning. She even had a hard time showing me her abdomen. It was very hard for her to show all this extra skin.
This looks like a man's belly. This is a huge overhang. And I've talked to other surgeons about this, and this is very difficult to
Randy,
do. I've been told.
This is not an all too familiar patient in my office. This is as typical as they become.
Okay.
As they get in my office. But let's go over it together. The extra skin starts way from above the belly button and goes.
What about this ugly dimpling?
Way below. And the dimpling, well, that's really the belly button, but you can't really see it. It's buried under all that wrinkled skin, the stretch marks from pregnancies. And if you were to examine her, she would have no tone to her abdomen. But the more important thing is, I want you to look at, and I want the audience to realize, is that this is not only extra skin, there's a lot of fatty tissue underneath it. If you just cut the skin from here to here, which I did, you're gonna end up with a very tight abdomen below the belly button, but very rounded up on top. It's not gonna look good.
Okay, tell me this, so I understand. You're saying you cut this much skin out from here to here?
That's what it took. That's what it took to achieve.
So that's this much
That's
skin.
about that much skin wrapped all the way around her.
You cut it out.
Cut it out, gone.
And then you, tell me what you do, by the way. Help me understand the tummy tuck aspect to this. What are you doing surgically?
Well, it's basically removal of a skin. You have to know how much to remove so that it comes together at one end, and tighten the abdominal fascia, bring the musculature back together. And then the liposuction comes in, a lot of liposuction.
Okay, so you cut out that area. And I guess stretch marks could be in between there, dimply skin, and then you're pulling it together?
The stretch mark is gone. They're thrown away. That's it.
Right?
You throw away the skin that has all that stretch marks. It's
so that's
gone.
like 6 inches of skin area.
At least, sometimes more.
Like
12 inches.
Like a
easily.
foot of skin you remove.
Absolutely, yes.
Seems like horrible scarring.
Well, no, not really. I'll show you some pictures afterwards.
Okay. So this woman's after we're going to see
Yes.
in a second, obviously.